Most researchers and clinicians focus on the pharmacological effect of ketamine. But unfortunately, this usually does not last. We have been using a combination therapy of ketamine IV treatments, transcranial magnetic stimulation, and intensive psychotherapy for many years. With this, we achieve a high degree of sustainability in our patients. As an example of our treatment, I want to show you the therapy of a traumatized Syrian refugee who came to us 1.5 years ago with severe depression and PTSD.
Also Vet war hier in der Klinik 3 Wochen lang. Sie kam mit schwerster Depression, mit Angststörung und auch posttraumatische Belastungsstörung, weil sie war aus dem Kriegsflüchtling. Wir haben angefangen erstmal mit Therapie, was ich erstmal eine Stabilisierung gemacht habe. Und dann sind wir auch in Ketamine-Sessions gemacht haben. Sie hat auch rTMS bekommen, Neurofeedback, Biofeedback, Sport. Nach 3 Wochen war ziemlich symptomfrei. Die war wieder bereit zum Leben. Sie konnte das Leben genießen. Die Ängste waren weg.
You have never taken any medicine, so like for a long time, antidepressants or?
Yes, I did try SSRIs for like 2-3 weeks, and the doctor, like I started feeling really bad, like worse.
Worse?
Yes, so I told the doctor and he was like, you can stop them. Sometimes when it's like really severe, I feel like I'm, you know, the tunnel vision. It's like I'm not really focused. I feel like my head is like filled with like a million thoughts. Like I feel it's hard for me like to breathe. Since 6 months for now, like I've been having suicidal thoughts like every day. Like whenever I feel like really hopeless, like if I'm broken, like I need to be fixed, but there is no way. This is like how it feels like. My thoughts are like really negative, but nothing can change them.
Durch Ketamin-Sessions, erstmal werden sehr viel innere Kräfte aufgebaut. Diese Ketamininfusionen wirken als Prävention für Retraumatisierung. Das gibt schon in der wissenschaftlichen Literatur. Ich habe mir getraut, einfach auf diese traumatischen Ereignisse zu gehen, mit diesen Verstärken selbst. Und das hat funktioniert. Also die Person, die wird nicht nochmal retraumatisiert. Die kann dann mit diesen Verstärken selbst dann diese Trauma sehr gut verarbeiten.
Ketamine made me like disattached from the suicidal thoughts. It's like I could literally see like my depression fading away. I was seeing everything differently. It was completely, like I was a completely different person mentally before the second infusion and after. I think after the second infusion, I felt like I don't really need anything anymore. Like I can handle myself. I even had like migraines and I stopped having migraines for like 3 months straight. So something physically changed in my brain and I don't know what that is. But it was just great because I felt more normal.
The patient responded very well to the treatment, and after a short period of stabilizing the patient through psychotherapy, we were able to administer the first IV ketamine infusions. Ketamine fortifies the mental state of the patient and prevents re-traumatizing during psychotherapy. Since the patient was very quickly stabilized, the psychotherapist was then able to start the EMDR treatment. Eye movement desensitization and reprocessing is particularly suitable for the treatment of trauma effects.
Since like the ketamine made me more disattached to these depressive thoughts, my brain kind of processed them better after the EMDR. I can just, there was like a space in my head, like free space in my head.
The repetitive transcranial magnetic stimulation, rTMS, stimulates parts of the brain with a strong pulsating magnetic field. This improves blood flow to certain parts of the brain and stimulates or dampens the cell's electrical activity, depending on the frequency.
The stimulation point of the rTMS was determined on basis of the heart rate variability of the patient. The result was F4. We started the first 2 weeks on the right dorsolateral prefrontal cortex with a stimulation of 1 Hz. Her resting motor threshold was 34%, so we stimulated with an intensity of 41%. Each session lasted about 20 minutes and she received 2 a day. The patient tolerated the treatment very well and reported already after 10 sessions an improvement in her mood. For other patients, this could take longer. On the right side with 1 Hz, the patient received a total of 23 sessions. A butterfly coil was used. The first few sessions can be a little bit uncomfortable for some patients, but this usually subsides over time. In the last week of treatment, the focus was more on the depression, and so we switched to the left lateral dorsal prefrontal cortex and to a program with 10 Hz. The patient also tolerated this program very well.
I think that was like the smoothest one, because I didn't have to think about anything. There was like, I wasn't like in a K-hole. Yeah, it was just nice. I would just sit there, relax. At the beginning, I think the impulses were a bit like annoying, but eventually like I got used to it. The first like week I didn't really feel that it was helping, but the second week I changed a lot.
The combination of EMDR and ketamine IV infusions and rTMS is a very novel way of treating post-traumatic stress disorder and depression. We are one of the first centers worldwide to offer this treatment combination. Did you have any other treatments after this time?
No, and I don't think I need to. So 1.5 years and I still feel fine. I think my anxiety is like kind of still there, or like it's back, but I think it's just like a natural response to everyday life. Like if I have like an exam and I didn't get the results, I think it's normal to be anxious. Yeah, but I don't mind the anxiety because everyone has anxieties, but I was just afraid that depression would come back, which it didn't. I know people are like scared of like become a different person, but you just feel more normal, you just feel more grounded, I'd say. And I didn't need I didn't really need any help afterwards, and I still don't. And I'm like very ambitious about life, and that was great.